Hello, my name is Michael David, and I'm a student of United States University. And right now, I'm going health history on the patient over here who just arrived in my clinic, and we shall get started. Hello there, my name is Michael David, and I'm here to take your health history. Before we start, is it okay for me to get your consent for the procedure?
Yes.
Okay, thank you very much. We shall start by asking your full name and date of birth.
Jane Doe, date of birth 9/4/1978.
9/4/1978. Okay. And can you tell me your ethnic background, please?
Asian.
Asian. And are you presently living with family?
Yes.
And how many people are there in your household?
3.
3. I hope everybody's feeling very well at home.
Yes.
And how did you arrive here in our clinic, ma'am?
I drove by myself.
You drove by yourself. Okay. And what brings you here to our clinic, ma'am?
Just for my annual physical exam.
Just for your annual physical exam. Do you remember the last time you had the annual physical exam?
Last year, January 2021.
January 2021. All right. Thank you very much. And I'm going to ask some pertinent questions regarding your health history, okay?
Okay.
Do you have any history of any other conditions in the past prior to your visit here?
Yes.
What did you have in the past, ma'am?
Asthma.
Asthma. Okay. And when did you have asthma to start with?
Probably 10-15 years ago.
10, 15 years ago. And have you ever taken any medications for your asthma?
Yes. They prescribed me with albuterol.
Albuterol.
Which I only use it as needed.
Mm-hmm.
Like if I have like shortness of breath or noted wheezing, that's the only time I use it.
And is this asthma still ongoing?
No.
No. Okay. Any other past medical history that you can recall?
I have skin allergies, eczema.
You have eczema. And how long before did you have your eczema?
Oh, it's been a while. Probably 20 plus years ago.
20 years ago.
Yeah.
Okay. And is it still ongoing?
It comes and goes.
Comes and goes.
Yes.
And have you ever taken anything for the eczema?
Yeah, they prescribed me with triamcinolone,
Triamcinolone.
which I just apply to the area when I have like flare-ups,
Okay.
as needed.
Okay. Do you remember of any past medical procedures that you may have had in the past?
I think I only had a skin biopsy.
Skin biopsy. And what year was that?
2015.
2015. Okay. Anything else that I should know of?
Not really. I think that's it.
Okay. And are you currently taking any medications right now?
Yeah, I'm taking vitamin C,
Vitamin C,
vitamin D3,
D3,
and just my multivitamins.
which includes C3 and C and D3, right?
Yeah, that's apart from them. It's like a daily multivitamin.
Okay. Any other medications like antibiotics or pain medication?
No.
No.
Tylenol as needed for, mild pain.
Tylenol. Pure. Okay. Do you have any known allergies that I should know?
Yes.
Okay.
I have latex allergy.
Latex allergy. Mm-hmm.
Codeine
Codeine.
and naproxen.
Naproxen. Do you have any food allergies at all?
Shellfish.
Shellfish. Right, but these allergies, let's say for example latex, what reactions do you usually get when you have latex allergy?
I have the rash.
Just the rashes, okay. And do you take anything for the rashes?
Yeah, I have the triamcinolone if if I see some flare-ups as
Okay.
needed. But
Okay.
of course, I try to avoid anything with latex.
Okay. What about codeine? What kind of reactions do you get with the codeine?
Oh, I have a raised heart rate.
Increased heart rate, okay. And about the naproxen?
GI distress,
Specifically, what kind of GI distress?
like diarrhea.
Diarrhea. And for shellfish, what reactions do you usually get?
Hives.
Hives, okay. For the codeine and the naproxen, what interventions or what do you usually do to avoid having these problems?
Well, I make sure I don't take them when they prescribe them to me.
Sure. And for the shellfish, what do you do for the hives?
Benadryl.
Benadryl. Okay, just Benadryl, oral Benadryl.
Yeah, oral Benadryl.
Okay. You did mention that you had eczema in the past.
Mm-hmm.
This eczema, is it related to your latex allergy or your shellfish allergy?
No.
No. Okay. They're totally separate conditions as
Yes.
far as you know. Okay. Do you remember your last menstrual period?
Yes.
And that would be
12/30/21.
12/30/21. Any problems with your menstrual period?
No.
Nothing whatsoever. Okay. Do you have any family history of any disease or conditions that you're aware of?
Yes.
Okay. Can you let me know, please?
Diabetes.
Diabetes. Okay.
Hypertension.
Hypertension. Mm-hmm.
And heart disease.
Heart disease. Do any of the family actually suffer from these conditions?
Yes.
So the diabetes is from which side of the family usually?
My father.
Your father. Hypertension is also from the father?
No, mother. And the heart disease.
Mother, okay. Do you have any siblings that may be suffering the same conditions as your parents?
Yes.
Okay. I'm sorry, I meant to ask, how many siblings do you have in the family?
2.
Two. And both are suffering from any of these conditions?
No, just
No,
one.
Just one. One sibling.
Diabetes.
Diabetes. Thank you very much. Okay, the next questions will be more of a personal manner.
Mhm.
So I'm just keeping the answer the best you
Okay.
can remember, okay? Have you had any problems with sexual or reproductive means? No. Okay. Have you ever smoked tobacco?
No.
Okay. Have you ever tried vaping?
No.
Do you drink alcohol?
Yes.
Yes. How often do you drink alcohol in a week?
A week? No. Probably just 1 to 2 glass a month.
1 or 2 glasses a month.
Yeah.
Glasses, not bottles.
No.
Okay. And have you ever tried illicit drugs?
No.
Anybody in the family actually tried illicit drugs?
No.
No. Are you currently married?
Yes.
Okay. What is your line of work, ma'am?
I'm a physical therapist.
Physical therapist. And are you performing any kind of exercise at home?
Yes.
Okay. What usually exercise do you actually do?
Treadmill.
Treadmills. And are you currently dieting?
On diet,
Yeah.
would you say?
Yeah.
I just follow a heart healthy, low fat, low salt diet
Okay. And then you said low salt,
and less sugar.
low salt, low sugar. Have you ever had any problems with dieting?
Any problems with dieting?
Well, what I meant to say is, have you had any problems with your diet?
No.
No problems with your diet. Okay. Have you had any problems with sleep lately?
No.
No. Do you sleep well at night?
Yes.
Okay. And have you experiencing any kind of stress so far?
Yes. Work-related stress.
Stress. Okay. I'm going to ask you about your immunizations and see if you can remember whatever you can, okay? Have you ever had all your childhood immunizations?
I believe so.
Okay. Have you ever had diphtheria, pertussis, and tetanus vaccine, DTaP?
Mm-hmm.
Have you had pneumonia vaccine?
Pneumonia, no.
Have you had the polio vaccine?
I believe so.
Pneumonia stays it though, right? Polio, yes.
MMR, yes.
MMR is also yes.
Mm-hmm.
Thank you. What about hepatitis?
Yes.
How about the HPV?
No.
No. Okay.
And
What-
the flu vaccine
Flu
and
vaccine.
the COVID.
Flu vaccine, yes. What about the Tdap?
Yeah, already.
No, the DTaP is for diphtheria, tetanus, and pertussis. Tdap is more of the typhoid fever.
Probably.
Okay.
I'm not sure.
Not sure what Tdap.
I had the varicella vaccine.
Varicella vaccine.
Mm-hmm.
Varicella. Okay. I'm sorry, but given with your ethnicity, have you been ever tested for PPD or TB testing?
Yes.
And how was the result?
I had a positive PPD test.
Okay. Have you been ever out of the country in the last 5 years?
No.
Okay. Have they ever started you on TB regimen for a positive result?
No, because I had a BCG.
Okay. No regimen has BCG. Have you done an chest X-ray to confirm you're clear from TB?
Yes.
X-ray. Okay. Thank you. Right, we're now going to be more thorough with the next set of questions with regards to your health, okay, or general well-being. Have you ever had fevers or chills, loss of appetite lately, or fatigue, or weight loss?
No.
No. Do you suffer from blurred vision? Looks like you are with those
Blurred
glasses.
vision? Yeah, I wear glasses.
Yeah, sorry about that. Yep, that's kind of obvious now. Yellowing of the eyes,
No.
tunnel vision, any discharges from the eyes,
No.
increased tearing,
No.
nope. Any other visual disturbances that I should know of?
No, apart from nearsightedness.
Okay. Any redness?
No.
And do you usually go for an eye exam regularly?
Yes, yearly.
Do you know when was the last time you had an eye exam?
Probably June 2021.
2021. Okay. All right. Have you ever experienced any hearing loss?
No.
Ringing of the ears?
No.
Have you suffered vertigo or any discharges from the ear?
No.
Any ear aches?
No.
Nothing at all. So your hearing is actually quite good.
Yes.
Okay. Have you ever suffered from runny nose,
Occasional.
blocked nose?
Mm. Yeah, occasional.
Okay. Have you had problems with sneezing,
No.
nosebleeds?
No.
Okay. Do you have any allergies that may result in these kind of situations?
Probably like seasonal pollen allergy.
Seasonal allergies. Okay. Do you have any problems with swallowing?
No.
No. No pain or no problems actually swallowing food? No problems. How about your teeth? Have you had problems with bleeding gums, toothache, mouth sores?
No.
No. And do you usually go to your dentist regularly?
Yes.
Okay. Do you remember when was the last time you saw your dentist?
I believe October 2021.
October.
It's twice a year.
Okay. All right. Are you wearing any dentures or crowns or fillings?
No.
No dentures. No. Dentures. Crowns. Fillings. Okay. Have you had problems with chest pain?
No.
No, no chest pain. How about palpitations?
No.
No. Okay. Have you ever suffered from low blood pressure or dizziness when you suddenly stand up from bed?
No.
Okay. Have you ever suffered from nighttime shortness of breath?
No.
What about swelling of ankles?
No.
Okay. And you're not having problems with shortness of breath right at this moment?
I'm sorry?
You have no problems with shortness of breath?
No.
currently?
No.
Okay. Have you ever spat out blood?
No.
Problems with, okay. What about wheezing?
Yes. Occasional.
And this is due to
My asthma.
asthma. Okay.
But never had it in the last couple, probably 5 years.
Okay. But apart from the asthma, you never had any wheezing before
Mhm.
like this?
No.
Okay. And you did mention that you have no problems with shortness of breath, right?
I do if I have like a flare, exacerbation of asthma, but it hasn't happened in the last 5 years.
Okay. Are you suffering from cough recently?
No.
What about increased sputum production?
No.
Okay. All right. Are you suffering, like I asked you this question before, but are you suffering from, or are you experiencing any problems with swallowing?
No.
Are you suffering from, or have you ever had constipation, diarrhea, and hemorrhoids?
No.
No. Have you ever had abdominal pain recently?
No.
Have you ever experienced or noted any unusual bleeding when passing out bowels?
No.
Okay. Is your bowel movement regular? And
Yes.
Okay.
Every day.
Every day. Do you experience any rectal pain when you move your bowels?
No.
Okay. Have you had any problems with reflux?
No.
Okay. Does anybody in your family have a history of rectal cancer?
No.
Okay. Do you have any increased urgency in urination recently?
No.
No. You have no problems in peeing, like hesitancy?
Mm-mm.
Have you ever increased, oh, okay. Have you ever increased frequency of urination?
No.
No. Do you pass urine with no problems regularly?
No problem, she said? Yes.
Okay. No pain when you pass urine?
No.
Okay. And you don't see, or have you ever noticed any blood when you pass urine?
No.
Are you in full control of your urine? Do you have?
Yes.
Okay. You
Yes.
don't suffer any leaks
No.
or incontinence? Okay. Have you had any infections which went in your urination?
No.
No. Okay. Do you have any problems with your menstruation?
No.
Have you ever suffered from vaginal discharge or STIs?
No.
No. Okay. Have you ever experienced or suffered from dryness or pain?
No.
Okay. What about abnormal bleeding?
No.
Okay. All right. Have you ever had problems with stiffness of joints?
No.
No. Any joint problems so far?
No.
No pain, no flare-ups whatsoever?
Mm-mm.
Okay. Have you ever had your joints swollen or swell? I'm sorry?
No.
No. Okay. How often do you have any muscle pain at all?
Not at all.
Not at all. Even when you're exercising, you don't experience any muscle pain?
No.
Okay. And have you had any problems moving your arms about or range of motion when you do your activities?
No.
No. Have you experienced or have you ever suffered from itching, rashes in the skin?
Sometimes if I have eczema flare up,
Eczema. Okay. Do you have any problems with lesions or wounds? Okay. Have you noticed any bumps or nodules?
no.
Okay. No, no unusual masses.
Mm-hmm.
Okay. And you did say that you have eczema in the past.
Yes.
Okay.
It comes in both.
Okay. Do you suffer from excessive dry skin?
Yes.
Yes. Okay. What do you do when you have this kind of problem?
Just moisturize.
Just moisturize.
Yeah. Especially
And
after
does it-
shower.
And it helps, right?
Yes.
And any discoloration of skin lately?
No.
Have you had any problems with your breasts?
Mm-mm.
No pain?
No.
No swelling or lumps you noticed?
No.
Okay. And no discharge from your
No.
okay, from nipples. Do you regularly do breast exam?
Yes.
Self-breast examination,
Yes.
right? Okay.
And also mammogram.
When was the last time you had a mammogram?
September 2021.
Mammogram. That's very good.
Mm-hmm.
September 2021. It's very important to have your mammograms done on a regular basis.
Yeah, yearly.
Yep, especially as we get older. Have you ever suffered any kind of mental breakdown, like anxiety or depression? What about mood swings?
No.
Okay. Any problems on the way you see in your body? Like, are you happy right now with your body image? Do you suffer from excessive happiness or mania?
No.
Do you have problems with food binges like bulimia?
No.
Do you have any, ever in the past, have you had any suicidal thoughts?
No.
Okay, or you don't have any thoughts of harming yourself?
No.
Okay. Anybody in the family that actually have a history of mental problems?
No.
No. Have you ever had in the past had any seizures at all?
No.
No. Do you suffer from headaches regularly? Oh no.
No.
No. Do you have any problems moving any part of your body, like motor weakness or any stuff like that? No. Any tingling sensation from any part of your body? Any part of your body that is not functioning or paralysis?
No.
No. Have you ever suffered memory loss in the past?
No.
No. Okay. Do you actually suffer from temperature intolerance, like heat or cold?
No.
No. Okay. Do you have any sudden weight change lately?
No.
No. Okay. No increased thirst, no increased urination, and no increased hunger?
No.
No. And you don't find anything unusual about your hair, your libido, or,
No.
Okay. No. Have you any problems with excessive bleeding?
No.
Okay. Do you bruise easily?
No.
No, you don't. Have you ever had like enlarged or swollen or tender nodes, like for example the nodes on your neck or your armpits, like that? No. And you did mention that you have allergies, right?
Mhm.
Which is allergies to medication,
And food.
food, and do you have seasonal allergies as well, right?
Yeah, you know, occasional pollen allergies.
Okay. Do you ever notice that you get sick more frequently than other people?
No.
No. Have you ever noticed if it takes long for you to recover from an illness?
No.
Okay. Are there any other additional things that you might have in mind that you want me to know so we can add in your history?
I don't think so.
Okay. Do you have any questions for me so far?
No, not really.
Not really.
Mm-hmm.
Okay. Well, that concludes our health history taking.
Thank you.
Thank you very much for your cooperation. We'll have a physical exam a little bit later. And that concludes our session for tonight for health history. Thank you very much for your watching. Thank you.